Good afternoon, everyone. We'll go on and get started. We do have a quorum. This is the Special Committee on Access to Quality Health Care, an effort we've been working on in various ways this year. We do want to announce that we have somewhat of a change from today due to the loss of a close family member of one of our chairmen and the funeral being scheduled for today. So we do have a change in the schedule. We will be having a hearing on HB 888 with Chairman Hawkins, and that is the only bill we will be able to hear today. I apologize, though, for those who may have traveled with an intention to discuss many other bills. I truly apologize. I wish we could have made this decision earlier, but we do have a concentrated committee, many committee chairmen on this committee who are very close to the member's spouse that was lost this past few days. So thank you for your consideration in that, and thank you for your participation. I will go on and call Chairman Hawkins to discuss House Bill 888 at this time.
Thank you, Mr. Chairman. We have 888 LC 460286S. It's 86S. This is pretty much the same bill that we had a week ago. And I'll go over the changes. There's just a few in here. This bill is about patients. This is not a bill about insurance contracts or hospital contracts or any of that other stuff. We are focused on the patient not getting a surprise bill. But I heard what this committee said, and I know that we had facilities in the bill in additional areas than what you saw last time. Some of those wordings were taken out for different reasons. One of the primary reasons is that under the ACA Act, if a patient goes as an emergency to a non-participating facility, which is hospital, ACS, all the institutions on a facility, that the insurer will pay. So the hospital is not balance billing that patient in that regard. If they go as a non-emergent to an in-network hospital, the hospital doesn't charge the patient because they're under contract. But this bill does address non-participating providers within that hospital, and it stops that surprise bill. What's going on now is going to get stopped. And what it does in the back of the bill is it puts in arbitration. I won't get into that today because I know that a number of you have another place to be. But let me go and tell you where the changes are. On page 4, line 125 and 126, we added back facility, okay? Whether the healthcare provider or facility furnishing emergency medical services in a participating provider or facility with respect to emergency services. So you've got, and if you looked in surprise bill up there, that's the definition of surprise bill, in-network facility, okay, non-participating. Then on page 5, top of the page, line 140, we inserted facility again, provider or facility. Line 131, provider or facility, and insert facility there. Line 154, inserted non-participating facility. Line 155, inserted participating facility. Line 170 on page 6, we inserted surprise bill. And those are the changes or the insertions that you saw. There has been some wording that was changed around. I actually struck notifying any participating which is on line 172. It just sort of clears up the language. But essentially, you got the same bill back with facilities included. And that's it. And I will ask, this is a hearing only. We're not voting on it. We've been asked not to take a vote. So I know that you may have a ton of questions, but there will be a piece of legislation coming that will have some amendments to it. But what we have strived to do is to keep mirrored language on the Senate side and on the House side. Although I realize that we perfect legislation in committee, there's been a problem with this piece of legislation. When we start sawing on it one side or the other, we never seem to get together on an agreement at the end. For the last 5 years, we haven't been able to agree, and the folks at home still get surprise bills. If we pass this, those folks will not get surprise bills, and you can go home and tell them that we did a good job. If we start sawing on this right now, you may not have that opportunity, and you'll go home and say, well, we couldn't fix it again. And that's not a good message for anyone, Republicans or Democrats. Because this is not an R bill or a D bill. This is a P bill. This is for patients. I rest.
Thank you, Chairman Hawkins. We'll take questions from the committee now. Chairman Houston. Yes, ma'am.
We did have part of this bill that if it was a non-emergency, that you had to let them notify how much the bill was going to be 48 hours ahead of time for ASCs. Right. And I felt like that the hospitals should have to do the same thing if it's not an emergency, to let the person know that they were not in network, that they were coming to the hospital to have something that was not in network. Is that still in the bill anywhere?
We took out some of the 48-hour language. There was some problem with that in agreements of how that was going to occur. It still is in the bill that they must notify the patient.
Would you please show me where it is for non-emergencies, where the hospitals have to notify them how much it's going to be in the bill? Because sometimes I think people get surprise billings when they don't really know exactly how much it's going to be.
Wait a minute. That last part I didn't understand. What'd you say?
I said I think a lot of times people get a bill that surprises them when they don't know how much there's.
Are you talking about from the hospital?
Yes.
Are you talking about from in-network?
I'm talking about out of network.
Are you talking about out-of-network?
Yes.
Well, yes, but the patient knows that that's an out-of-network facility.
How does he know?
Well, he can ask the question. There's some responsibility for the patient. They can ask their insurance carrier. They're the ones that set the contract up.
Sometimes people don't have anywhere to go but one hospital that might be out of network when you don't have one hospital in town.
Right. Well, that's the definition.
Let me get a clarification, please. Are you talking about non-emergencies?
Non-emergencies.
Right.
So non-emergencies.
You had non-emergencies for ASCs that you had to notify them 48 hours ahead of time.
By definition, that's not a surprise bill. This is a surprise bill.
Wasn't that in the bill we saw the other day?
Oh, I'm sorry, I can't hear.
Just one second.
Didn't I see that the other day?
Is line 202 the part that deals with non-emergencies at non-participating or out-of-network providers, starting at 202, that section? I believe that's where it is. Now, it doesn't say 48 hours.
Well, didn't we have a bill the other day that said 48 hours?
Not the last one you saw, but we did have an LC version of that. Yeah.
Okay.
Right. The only difference between the bill that you saw the other day and this bill is the facility being added and surprise bill being added into place. But the gentlelady is correct. There was one with that.
But this
all honesty, yeah.
Chairman Hawkins, this does starting on lines 202 and following, does address a covered person being able to choose an out-of-network provider.
Right. That's the freedom to choose section. That allows a patient to go to any hospital or any provider knowing that they are out of network and willing to pay the balance bill. That way you cannot be directed away from a provider that you want to go to. But I understand your question. Your question is about the hospital and out of network. And that does go back to that's not a surprise bill because the patient should know or someone should inform them. And I would say the insurance company that they have a contract with, or yes, the hospital. And I know that hospitals are doing that now because they see the problem that they're heading into. Now, we've heard a lot about patients still getting these surprise bills. Really, those bills are the deductibles and co-pays on these emergency situations because you're still liable for your deductible and co-pays, whether you're in-network or out-of-network. That's a contract between you and your insurer.
Chairman Hawkins, could you look at line just 207, 208, and 209 for me? Mm-hmm. And see if those, they don't ever say 48 hours, but it does say that they're notified written and oral consent in advance, and then only after they've been provided with an estimate of the potential charges on line 207, 208,
That's
and
right.
209. And that doesn't specify 48 hours in
No.
advance, but it does say they will be given written and verbal consent obtained in advance prior to the services.
Right.
Is that correct?
Yeah, and that's the way it's working now. When the patient calls the provider's office, the provider's office will say, you know, are you insured? What insurance do you have? And they will say da-da-da, and then they will say, well, we're not in network with that insurer. They inform them at that point, and you will be responsible for the balance of the bill, and the patient will say, well, how much are we talking about? And they will give them an estimate, and then the patient says, yeah, I'm coming, or no, I'm not. You know, the free market still works in Section 7. And to me, that's a very important part of the bill. Well, it all is, but I really like that freedom of choice. So are we clear? Out of network, they should know. You're right. If they don't, we can't fix that with this bill. This bill is a surprise bill. That's not a surprise bill. Out of network facility or out of network provider.
Thank you, Mr. Chairman. Chairman Hawkins, and again, I apologize, I'm obviously catching up on this part of the bill, but.
Speak
what
up just a little bit,
What happens
please.
when you go to a facility for a scheduled procedure?
Right.
And some of the doctors are contracted and are part of the insurance plan, and some are not.
Right.
How-
Those
how does
inside
that
the
help?
plan will accept what the fee is. They do not balance bill part of their contract. Those outside will want to balance bill, and by this legislation, if you vote to pass this, they can't do it. They and the insurer will settle that through arbitration, and the patient's taken out of the middle of that.
That's the prime goal of the bill, is the definition of a surprise bill is you've gone to an in-network facility, and then you've gotten one of those, what you just described.
No, yeah.
Exactly.
Personally, has happened to
Yeah.
us, and then,
It does.
okay, all right.
Yeah. And if I sound short, I don't mean to.
No, I apologize. I need to catch up.
I've been living this thing for about 3 months, so I sort of get to the answer too quick sometimes, I guess. I mean, I can see that we're getting a bill that we can pass, so.
Thank you. Are there any other questions for the author? We will plan to vote at the next time we bring this up. I did want to make sure everyone had an opportunity to read the new language with facility added, and then has an opportunity to inquire to the author.
And anyone, you can come ask me questions, you know.
One moment, Chairman Cooper.
Okay, does facility cover the hospitals in all incidences?
I'm sorry, I couldn't hear you.
Does the word facility cover the hospitals
Yes,
in all instances?
yes. That's in the definition. So whenever you see facility, it's hospitals, ASCs, birthing centers, just what's in the, definition. Yeah.
Explain to me on 216, you refer to as providers, but you don't say facilities then.
216. Okay, let me see.
See,
Yeah, 216, you're into the non-emergent section. In fact, you're into the patient freedom, where they're choosing an out-of-network provider, and they're agreeing to a balanced bill.
okay.
Chairman Cooper. Well, okay, so they're choosing a provider, and they can decide whether they want to go to one in-network or out-network, but they could also do the same thing about a hospital. Decide, it could be out-of-network too, so it ought to be covered.
Well,
Are the
if they go
others-
to an out-network hospital under this, then they can be balanced bill. It's their choice. It's not a surprise bill. I mean, out-of-network is somebody that doesn't have a contract. So they're not bound to accept the fees and the payments of the insurer. I mean, if we're trying to get at making out-of-network, non-contracted facilities, providers, anyone in healthcare accept a contract that they've never signed, then I think we're probably going a little too far. With this bill, if you want to do that in the future, you know, but this bill is a surprise bill, and definition is,
Right, but why wouldn't it say the referring provider or facility?
I'm sorry, what? I'm
Like
sorry.
on line 216, why wouldn't it say the referring provider or facility?
Referring,
That covers the person that the reference provider or facility is non-participating. Why wouldn't the hospital be in the same thing in there, or a surgery center or whatever? They would need to say.
I apologize.
I'll go to legal counsel. I'll look it up.
I apologize, I'm just not hearing you very well over here. But what section are you in, or what line?
I was on 216. I will go to legislative counsel and get it clarified for myself, and then I'll come and talk to you.
I can, okay. Again, that section is for non-provider, a choice, patient choice of non-provider, whether it be facility
understand
or,
that.
and you want facility placed in there.
I mean, I think that
Yeah.
if the choice is being made, I think it should cover facility also.
Right. Well, yeah, they're out of contract, so I think that was, okay.
Representative Perkle.
Thank you, Mr. Chairman. And Mr. Chairman, thank you for bringing this. This is, surprise billing is something that does impact a lot of us, and quite honestly, so somewhat selfishly, I am 52 years old, and there's a certain procedure that I'm supposed to do in that 50 range. And I had a buddy that is my age that has already completed that task, and he was mad as a wet setting hen when he checked with his provider, and it was in network, and he goes to sleep, and apparently it's pretty important that you go to sleep during this one. And after everything came back okay, he got the surprise bill from, he thought he'd done everything right.
Right.
Where in this bill, and I apologize, not
Section
being
5, that's a non-emergent section, and that's one of the purposes of this bill. He will not get a surprise bill with this. They will go into arbitration with the insurer.
Okay, so that's where the arbitration hits in section 5.
Correct.
Okay, well, thank you.
Oh, sure. I mean, that's sort of like he had a self-study course at home, huh?
Yes, sir. Any other questions? Chairman Knight.
One other question. Thank you, Mr. Chairman. And again, friendly question. Just, again, I apologize if I'm catching up on this. So in here, we see throughout that nothing applies to ERISA, basically.
Right. It's federal law.
Yep. So my question is, most of Georgians, or a lot of Georgians, are up under, a self-funded plan or something that's covered by
Right.
ERISA.
Right.
So how do we make sure that they understand that we've done everything we can at the state level, but the insurance plan is not going, they don't have to comply with this, this is not law, in other words, so that we're trying to address it within our powers. Now,
Right.
this is a friendly question, because
No,
we
I
get in
got you.
trouble, because as
I
legislators,
got
we
you.
try to deal with it with the best we can.
Sure.
But the insurance companies somehow end up not, notifying, or in cases of this plan versus that plan,
Right.
they end up getting away with it because they never change. They'll continue the practice. Is there anything we can put in here or on these bills that would
That's a good
give notice,
question.
give notice? Because
Yeah,
again,
that's a
we're
good
trying to do
question,
everything we
because
can.
the insurer is required, when they remit payment to the provider, to include the wording that this is a non-ERISA, I mean, this is a ERISA exempt plan, which tells the provider he can't send it to a credit agency. This bill does not apply to them. Also doesn't apply the 26-A, which is CMOs, Medicare, Medicaid. There's a number of exclusions in the bill down on the bottom page of 2.
But in the end, those cases, the patient will end up getting,
Unfortunately.
is there, again?
Chairman Knight, if I might answer, I appreciate you joining this committee and the Speaker putting you on this committee and as a voting member, and I appreciate that. We did have an earlier bill, though, that I guess, were not privy to, that did address the one thing we can do, which is shine a little transparency light on the networks themselves, which are almost always the same at an ERISA plan and at a, not 100%, but close to 100% are the same in the ones that are fully insured that the state does have jurisdiction over, is the same network with a particular insurance plan almost always as ones that are in the ERISA plans too. So by shining a light on that, for example, the out-of-network the in-network hospital where a procedure was done, but one of the providers was out-of-network, that will at least be on the website for the network to where you have an opportunity, even if it's an ERISA plan, and hopefully people will choose plans that don't have that particular issue where the hospital's in-network, but some of the contracted providers are not. So we're doing all we can, which there is limited, as you point out, on ERISA plans that are under federal jurisdiction, but this bill is a key part of that on giving an agreed upon burden sharing between the insurer and the provider who don't have a written contract with each other, but they've agreed to take the patient out of the middle by both sharing the burden. And that's been the balance, I think, that Chairman Hawkins has talked about, the difficulty that we've tried reaching that in previous sessions that this bill seeks to do. So
And
hopefully
this
that
bill
helps with those
passed the
two
Senate
questions.
54-0, unanimous.
Any other questions for the author of the bill? Well, thank you for y'all's study on this bill. As I mentioned, we are going to postpone the remainder of the agenda for now, and I once again apologize, but thank you for participating in this important first step or additional step in dealing with surprise bills for patients in Georgia and that access. Thank y'all. We're adjourned.